My main goal for every patient is to improve their quality of life. I'm Alexis Williams, and I'm a shoulder and elbow surgeon. I see patients at King of Prussia and Bryn Mawr Hospital, and I operate out of Bryn Mawr Hospital. So there are a few things that I tend to see fairly often in my daily practice. A lot of tennis elbow, tendonitis type things. In the shoulder, rotator cuff tendonitis, frozen shoulder, arthritis. Rotator cuff tears, those we tend to treat non-operatively, whether that be with physical therapy, anti-inflammatory medications, even injections. I think that physical therapy, particularly in the shoulder, can really be effective in improving the mechanics of the shoulder and thereby keep people out of the operating room. In terms of shoulder, the procedures that I tend to do are arthroscopic, meaning through the skin and with just a little camera, and fixing rotator cuff tears or labral tears, patients with shoulder instability, fractures, and then shoulder replacement surgery. For the elbow, I really am doing fracture repairs, nerve releases, tendon repairs. I think it's important for patients to understand why exactly they're having pain so that they can better understand what the problem is, and then provide them with options to help alleviate that pain so that they can make the best decision for them. The shoulder's a ball and socket joint, and around the socket is what's called a labrum. The labrum's job is to help keep the shoulder in place. And when there's dislocations, that labrum can be torn. And if it's advanced enough, then we recommend fixing the labrum in order to help keep the shoulder stable. When there's rotator cuff tendonitis, our body wants to naturally splint itself. Those other muscles around the shoulder tend to take over. And if the mechanics of the shoulder aren't normal, then it's not going to feel normal. It's really wonderful to be in a practice that has many different subspecialties within orthopedics because, your body's connected to each other. There is an overlap in people's symptoms. People come in with thinking it's their shoulder, but really it's coming from their neck. And so, my role is to really help people get to where they need to be. What I love about what I do is that I make people feel better and I can restore people's function and provide a better quality of life.